The next test I'm going to have Reggie do, what you guys are going to need is a band. You can use a belt, anything along those lines, just a strap to help stretch the hip out here. Okay, so she's going to stay lying down flat on her back. She's going to loop that belt band, whatever you have, kind of around the shin area. And the first thing we're going to do is we're going to test her hip internal rotation. Okay, so her hip is up at 90 degrees, knees bent at 90 degrees. She's going to take her left hand if you're testing the right hip, and she's going to pull that foot out to the side as much as she can. So we're internally rotating the hip here. Her foot's coming out to the side. The femur, the thigh bone is staying right where it is just simply rotating in that pelvis. What we're looking for here, again, is there any sort of pinching in front of the hip there? A lot of people aren't going to be able to move their hip at all here. That's also just a test too. We want to see how far out you can bring that hip. Okay, so this is her passive range of motion, how much she can stretch. What we're going to do now is just test the amount of passive she has versus the amount of active range of motion she has. So she's just going to drop the band. Everything's going to stay at a nice 90-degree angle here. She can use her left hand to reinforce, and she's just going to rotate her foot out to the side. So Reggie's right hip looks pretty good. The active matches the passive range of motion, and she can relax there. So again, hip, internal rotation, two different tests there. Passively, how much range of motion, how much can you stretch that hip? Do you feel any of that deep hip pain when you do it? And does that passive range of motion match your active range?